8:29 right here on 620 AM KEXB, your experts in business. Now, moving yourself away from anything that's addictive is a very difficult task. And I'm talking about it can be as simple as drugs. I guess that's the first thing that comes to my mind. But it can be a habit. It can be something that's happened into your past and things that that pulls you in the right direction. Harold Urschel, did I say that right?
Yes, you sure did.
Okay, he's the author of the best-selling book, Healing the Addicted Brain, and is joining us now in the studio. Good morning.
Good morning. Thank you for having me.
Thank you for coming. I got the book a couple days ago, and I was kind of flipping through there. Very interesting stuff, and it seems like the key to get away from substance abuse, any type of to get away from anything traumatic that has happened in your past, is really kind of tapping into your brain and just getting your brain to shift away from wanting those things.
Absolutely. Specifically with alcohol and drugs. I mean, you mentioned alcohol. You mentioned drugs, but the big 800-pound gorilla out there is
Sure.
alcohol. If you took all the drug addicts and put them into one group, and you have to multiply that by a factor of 10 to get the number of alcoholics that are out there. So, alcohol kills over 100,000 Americans a year. It's right up there. It's the third leading cause of death: heart disease, cancer, alcohol. So we really we have some great treatments. The problem is most people in the country, actually in the world, don't think addiction is treatable because most of the treatments that we're applying to this disease have a success rate of about 25%. It means it's a lethal disease. 75% of the people die. So most people don't think people get better, and that couldn't be farther from the truth when you approach it correctly.
Yes, and we were talking in the break is when it comes to minimizing the DUIs,
right,
and getting someone away from alcohol abuse.
Yes,
this is pivotal because you can stop the cycle of.
Absolutely. You can get treated the first time and get better. Again, alcohol and drug addiction is a chronic brain illness. It's an injury, just like Alzheimer's, just like a car accident or a concussion in football. Alcohol and drugs are neurotoxins. They injure the brain. There's a huge amount of science over the last 40 or 50 years that have shown us that alcohol and drug addiction is a brain illness, and it's given us lots of great treatments on how to use it. Unfortunately, this is the only field in the country in medicine where the science isn't embraced as soon as it comes out, whether it's heart disease or high blood pressure or diabetes. As soon as a new treatment comes out, all the hospitals want it. In the addiction field, whenever a new treatment comes out, most treatment programs will snub their noses at it, turn away, and not even embrace it. And that's just not the right way to address a chronic brain illness, especially one as devastating as this.
Now, how do you address that?
Well, basically, it's real simple. You just take the science and you apply it in clinical day-to-day interaction, and you help these patients. We do that. I work with a company called Enterhealth here in Dallas, and we created Enterhealth to try and focus on applying the science to treat a brain illness. And before we started doing this, the outcomes were significantly different in terms of your traditional program got about a 25% success rate. When the National Institute of Health looked at applying the science, they got about an 85-90% success rate. And that's the kind of success rate we've been getting with Enterhealth over the last 8 years. And people have gone to 3, 4, 5, 12 treatment programs before they come to us sometimes. And they said nothing will work. They keep relapsing within 3 months, 6 months, a year after they get out. And once they get on the right medications, they get the right treatments, they're just not relapsing. They're staying sober for years. I mean, we have people that have been sober for over 8 years when they couldn't stay sober for a couple months before they came to us. So, and there's really cool things out there. For instance, there's a shot for alcoholism now. Okay, so it's been out for about 10 years. It's paid for by every insurance company out there. It's called Vivitrol. And so basically, if you get this shot for alcoholism, it basically within 3 days. First of all, you get it once a month, so it lasts for an entire month. Once you get the shot, you're on the medicine.
What's in the shot? What is Vivitrol?
It's on a medicine called naltrexone, which has been around for about 70, 80 years. It was approved for heroin and opiate treatment back in the 60s. It was approved for alcoholism back in the early 90s. And they put it into a shot form in 2006. And so when you get this shot, it works in the brain. It's not addicting, not sedating. It's not the one that makes you sick if you drink. It's like a vitamin. You don't even know you're on it. but it decreases your cravings for alcohol by 90%, so you don't want the alcohol. If you do drink, it essentially turns alcohol into water in the sense of you can't get drunk. So for the entire month, you can't get drunk. And if you do have a drink, you only want a half a drink and you feel kind of full. First of all, you didn't want it, remember, because it took away the cravings. Second, you didn't get drunk. And third, you didn't want much. So you put it down and then you can go back. You shouldn't have drank in the first place if you're an alcoholic, but it makes it easier to stop. Now, it sounds great. It's not the silver bullet, but again, most physicians have never heard of it. Most treatment programs won't use it. They won't use it, especially after the patient leaves. And so it's just, there's these opportunities out there to make a huge, huge impact in treating of this illness. People don't know, they don't know the problem. So that's one of the reasons I wrote the book, because we talk about all these medicines in the book. But again, it's better. You can take the information in the book to your local doctor, and you can get on some of these medicines, and your loved one can get sober for the first time in a decade.
Dr. Harold Urschel, best-selling author of Healing the Addicted Brain, the revolutionary science-based alcoholism and addicted brain recovery program. So give me some examples. I know you've said some people. How long does it typically take for when they start this process to the end result?
Well, again, each person's different. When you have alcohol and drug addiction, your brain's injured. Usually, you also have psychiatric illness, depression, anxiety, sleep issues, manic depression, all the same types of things you would get with a concussion, with a car accident, et cetera. Sure. And so, usually, you're feeling. We can get you detoxed in 7 or 8 days here at Enterhealth, and then you can move on and get into treatment. Within 30 days, you're feeling. Outpatient or inpatient. We have a residential facility. We have outpatient. Not everybody has to go inpatient to get better. Inpatient's usually easier because you're isolated from the treatment, from the world. And so you can get sober, your brain can kind of reboot, and then you come into outpatient. So within 30 days, you're feeling a lot better. Our average length of stay is about 55 days in the residential facility. Some people stay 2 weeks. Some people stay 3 or 4 months. But the inpatient part is not the real magic. The magic happens in the outpatient. It's just like diabetes. If you have a crisis in diabetes, you're going to go in the hospital for a period of time, but then you're going to come out and you have to manage that illness over a long period of time. And so we have, there's all types. The problem with addiction treatment is it's a complex illness. Any brain injury is complex, right? Any major illness is complex. So you have to manage the psychiatric pieces. You have to manage the brain injury. You have to manage family programs. Family problems. So family therapy is important. Wellness, nutrition, stress management, all kinds of things. If you have a stroke or if you have Alzheimer's, you're going to have all these different pieces of the puzzle. It's science. It's not rocket science, but it's just this is what you need to treat a brain injury. And one of the problems with alcoholism is people go, why does this person keep drinking? Or heroin addiction. Why are they using the pills? Why are they going back and shooting heroin? They've been in jail twice, and they're about to lose their wife. They're about to lose their job. Well, a rational person wouldn't use. Right. Well, the problem is, this illness takes down the central computer, which is your brain. And so when your brain's not working, that's all you have to make decisions. Well, once you understand that, you can see why these people make bad decisions at certain times because their brain's not working. If you had Alzheimer's and you're running around naked outside in the morning, well, people go, well, that guy has Alzheimer's. Let's bring him in and take care of him. Let's try and help him so he doesn't do that. Whereas if an alcoholic or a drug addict happens, they'll put him in jail or they'll kick him out of the neighborhood. They won't offer any help.
That's a great point.
This is brain injury. But the beauty of compared to Alzheimer's, once you get it, you got it for a long time. It's just going to get worse. The beauty of alcohol and drug addiction, you get the right treatment, your brain gets better. Your brain can actually heal. That's therefore the name of the book. Your brain can heal, but you have to stop poisoning it. So you have to be sober for 12 to 18 months. And in order to do that, that's pretty hard unless you have a lot of other tools to use to help you stay sober. That's what the science is telling us.
At the end of the day, when these people come through this and they've completely healed, what's the feedback that you're getting? I would imagine their loved ones, especially, have come to you and are saying thank you.
Right, they're doing cartwheels. You've changed their lives. It's a very rewarding field because when you apply the right treatments and they get better, you're not only helping a family get back together, you're changing the direction, the trajectory of that family for generations. Because this is this is a medical illness, so it's a genetic. It's passed down through families, and just like diabetes or heart attacks, et cetera. So you're making a big impact. They're very grateful. The families are pretty scared that the person is going to relapse. So when you have the tools to help their loved ones so they know they can't relapse, it makes a big impact. Again, this is not just about giving medication, but the medicines make it easier to stay sober and make it easier to apply the tools you need to get better.
And you've been on Dr. Phil and some other national platforms talking about this.
Yeah, I've been very blessed.
You're a leading expert in this field.
Well, I think God's given me the opportunity to be able to be relatively passionate about this. It's so easy when you see this huge problem. You see the answers are out there, the treatments are out there, but nobody's using them. So one of the efforts in writing the book or starting Enterhealth was to create a grassroots movement to educate people. If people just had this information, I kind of wrote the book for the mom. The mom is hardwired to protect her offspring, her son or daughter, and if that son or daughter gets addicted, they have a brain injury. They're not telling the mom how to get them better. Saying just send them to AA. Well, there's nothing wrong with AA, but AA by itself, Alcoholics Anonymous, is not enough any more than a diabetic support group by itself is enough to treat diabetes. If you have diabetes, you need medicines, you need a whole bunch of things, and a diabetic support group can help you. Well, AA is really helpful, but most treatment programs out there are saying AA is what you need. AA, when you get out of this program, is what you need to do, and that's it. And if you relapse, people are telling the addict they don't want it bad enough. You're not going to enough meetings. It's almost criminal in the sense that you need to give the American people the information, and that information's hard to get sometimes, and that's why why I'm here this morning. I
want to know if you can help us break the addiction to coffee and donuts. Is that possible? Because we have a problem with that.
The coffee and donuts. I think that the science hasn't come out hard on that yet, and unfortunately, the Vivitrol won't work for donuts.
No, it won't work.
Or
that is interesting cookies. Stuff. Wow.
Yeah. It just gives hope. The idea is people, most physicians, most colleges, most judges, they feel that there's no answer, so they're just kind of throwing this group of people away. And it's 10% of the country. And right now there's this opiate epidemic, which is pain pills or heroin, and it's a massive problem, especially in the Northeast, but everywhere. But 5 years ago, it was methamphetamine. Before that, it was cocaine. But alcohol is always there. And the thing I'm most scared about right now, we have great treatments, by the way, for opiates, for the heroin and pain pills. The one I'm scared of most about right now is marijuana. Marijuana is a huge problem. It's very toxic to the brain. It's very toxic to the body. The information's not out there. It's not safe. It just because 2 or 3 states have legalized it. I mean, look, when was the last time that any of us realized that the political process made sense? I mean,
you're on the right show for that. Doctor, you're on the right show for that.
Absolutely. So the point is, marijuana is not safe. It injures the brain. It causes psychosis. It increases your risk of lung cancer 4 times more than a cigarette. So it increases your risk of heart attack. And there's nothing safe about it. And our young people that are starting to use it more and more just because they perceive that it's not dangerous anymore, it's decreasing. It's changing their trajectory. They're not able to do well in school. They're not able to get into the college they want. They're not able to get their job they want. It's destroying their families. And we have great treatments for that. But the problem is so many people are using it, and there's so much misinformation out there.
Yeah, I'm so glad you touched on that, because we've talked very much about these liberal policies, how they're put in place. We've got to take a quick break. We'll have more with Dr. Harold Urschel.
That's fine. No problem.
Like Herschel Walker.
That's right.
Here you go. I love you. To give us a few minutes, we'll come right back and talk about this and a lot more. Tuesday's gray and Wednesday too. All right, we're back, 8:47 right here on DFW Business Today. Let's continue our conversation with Dr. Harold Urschel about, did I mispronounce it?
It's okay.
Urschel. I don't know why I can't see that.
Don't worry about it. It's no problem.
But what I can say is that you're doing it right. Because
his friends actually call him Hal.
Hal. Let's just call him Hal.
Yeah.
I'm a Dr. Hal.
Dr. Hal, is that okay?
That's
Hal.
perfect.
Awesome.
You've got a book out, and it's really aimed to treating the brain from wanting these addictive substances. And in the break, we were talking about, I asked you a question about the age range that we're looking at. I mean, you typically think of someone addicted to drugs or alcohol as a younger generation, but that's not the case.
No, you actually see different demographics. You're seeing the college age and early 20 group of addiction. You're usually seeing alcohol, designer drugs, opiates in that area. Then in the late 30s, in your 30s, essentially, you're seeing another group, and that's usually alcohol. And then 50 and above, you're seeing sedatives, Xanax, Valium, etc., sleeping pills, and opiates, meaning for chronic pain, and alcohol. So you're getting these different ups and downs. So the older you get, you're not protected from addiction. Mm-hmm. Essentially, what happens is when you're under stress. First of all, alcohol and drugs are just everywhere in our society. We're being brainwashed that most of them are safe. Okay, and so all that information is wrong. But as you get stress in your life, you might end up using these substances to deal with the stress. And after a while, if you have a lot of stress and that's all you're doing is you're using substances, the more of a substance you use, the more chance it has of injury in your brain. And at some point, you've done enough injury, you're now addicted. Your brain's changed for the rest of your life.
And as John was walking out the door in the break, he had brought up the electronic cigarettes, and I think some of that stuff can be just as harmful to your body. I mean, I don't...
I'm not a doctor, and I'll let the doctor speak to this, but this stuff is made for pennies, like somewhere overseas. The idea of actually smoking it,
is that
putting
addictive,
it in your
doctor?
Lungs.
Is that type of...
Well, I think they mix nicotine with it, I think.
Yeah, right. They can mix nicotine with it. They can mix pot with it. The electronic cigarettes is purely just a vehicle. It vaporizes a specific substance, which means it allows it to go into your lungs, and things that are inhaled in your lungs get to your brain a lot faster. So that's why you might smoke cocaine, smoke methamphetamine, smoke marijuana. You get a high because it goes into your system much faster. So the nicotine, like if you put on a nicotine patch, it doesn't relax you. It takes away the cravings. But if you smoke a cigarette, it gives you a euphoria. It gives you a relaxation. So again, the e-cigarette, there was a perception, well, you're putting the carcinogens in your lungs. Well, like you'd mentioned, John, is that you're getting other medical problems that we haven't studied these, and they're proliferating as fast as you can blink. So we don't know the dangers associated with them. The problem with the e-cigarettes is you can change the potency of the nicotine. So you can get very, very potent nicotine. You can get very high doses, so you can get more heart attacks, you can get more strokes. I mean, nicotine is one of the more addictive substances. Mm-hmm. It's hard to stop. And also nicotine, especially early on in younger kids, like in teenagers, et cetera, it will prime your brain. If you start smoking cigarettes as a teenager, it makes it easier for that teenager to become addicted to other substances like marijuana, like cocaine, like alcohol. So it kind of sets up your brain to become more easily addicted, which nobody ever talks about. So that's even another reason not to try and smoke.
Yes.
A lot of people kind of look at this conversation like the young kids are like, oh, these just adults, and these squares are not cool.
They don't know.
Yeah, they don't know. But the bottom line of it is like, he's right. I mean, a lot of kids when I was in high school that smoked cigarettes automatically, then they started smoking pot. Right. And then they moved on to other things. Right. And it's the gateway drug is like...
It is a gateway drug. And I'm so glad you brought the marijuana topic up. And I definitely want, when we have more time, want to have you come back on and talk a little bit about that. Now, let's talk about the treatment center that you do have. And if someone wants to get a hold of you guys, the website's really simple, enterhealth.com. And you have an 800 number that's on the website as well. It's 855-393-8656. That's 855-393-8656. And we'll post this stuff up on our social media platforms. But this is, if you're dealing with someone with an addiction, they definitely need to reach out to you and get help.
Absolutely. If you're living in DFW, and we get people coming into the residential facility called the Enterhealth Ranch from all over the world because we're so unique. But here in Dallas, Fort Worth, we can really get your loved one better because we're going to assess what does your loved one have, what are the problems that he or her have, what is the family what's going on in the family, what's going on in the legal situation, what's going on at work. We'll treat all those pieces, and we'll treat them over a long period of time. You go out to some of the more well-known treatment centers outside of Dallas, and the problem is that they're not going to apply the science, and when you come back, they're not going to engage you in outpatient. And if just put it this way, if you have a bad back problem, you go to the best go to the best back surgeon in the world, you get treated, you come out of the hospital, and you go to a really bad physical therapist who screws up your back again. Who cares if you went to a great back surgeon? So it's the outpatient treatment. Funny. It's the outpatient programs that can, in any chronic illness, whether it be diabetes or heart disease, you want great care at both levels, and that's what Enterhealth brings to the Metroplex.
The book is called Healing the Addicted Brain. Thank you so much. I'm just going to call you our doctor expert on the show, Dr. Hal.
That's perfect.
That's
Thank
just
you.
so I don't jack his last name up.